now let's discuss about that where we are using these drugs. So the first case where we are using these drugs are commonly prescribed, and that is called as the functional disorders. That is called as the functional disorder. Means there is, you can say, disease where you see the psychosis commonly, as I cited an example. No, I cited the example, okay, and that is called as the schizophrenia. Okay, schizophrenia is a, you can say, severe mental illness, okay, where there is a disturbed thought, okay. Patients have the different kinds of, you can say, hallucination, delusion, illusion, fine. Along with that, patients have, you can say, social withdrawal. Patient is, you can say, become isolated, and there is a flattening of emotions. Got it? So these are the schizophrenic symptoms, and that's come under the functional disorder of mind. The literal meaning of schizophrenia is called as split mind. Okay, split mind. Fine. Now coming to the affective disorder. The word affection or affective, starting from the A, this represents the mood. So these are basically a mood disorder. Now under this mood disorder, two diseases which is prominent. The first disease is called as the mania, okay, and another disease is called depression. Fine. So the first indication where we are using this psychotropic drug, the first example is the functional disorders, example schizophrenia. Then another is the affective disorder, also called as the mood disorder, and the disease is called mania and the depression. Mania is a, you can say, it's a hyperactivity, okay. Mania is a hyperactivity, okay. There is a severe mood elevation. There is a severe mood elevation. Fine. This is called as the manic patient or mania. Depression is opposite of this mania. Okay. In the depression, okay, patients have the lack of motivation, okay. In the severe conditions, they stop to eating the food, and there are many more things, okay. We will discuss when we will discuss the antidepressant drugs. We will discuss about the depression in detail, but for a while you just understand that the psychotropic drugs are also used to manage the mania and depression. So the drug which is used is called as anti-manic drugs for management of mania, and another drug which is used to manage the depression are called as the antidepressant drugs. Fine. Now coming to the neurosis, as we discussed, this neurosis is a milder form, okay. It's not a severe mental illness. Here the contact of reality is intact, patient is intact with the reality, but they do have certain psychiatric symptoms. Example is the anxiety, okay. Apart from that, something called phobias, fear from different things, fear from water, fear from darkness. Got it? Then there's another disease, okay, which is related with the personality, and that is called as the obsessive compulsive disorder, OCD, okay. OCD, person have the limited, you can say, space where they can think, okay, and there they are obsessed. Okay, they are if they are doing something, okay, they are doing some things, they don't have the other ideas. They have the limited, you can say, ideas. If you take the example, you can take the example. If you are, you can say, going somewhere via bus, okay, and you have, you can say, 500 rupees in your purse, 500 rupees in your purse, fine. But once you can say went from your home, you check your purse and it is there, 500 rupees are there. Then again after taking 5 to 6 or 7 steps, you again want to check your pulse. Fine. When you go to the pulse, you again check. So continuously you have the limited, you can say, thinking zone, limited thinking area, and that is you can say the clinical feature of OCD, obsessive compulsive disease, or called as the disorders. So these are certain, you can say, disorder where these psychotropic drugs are commonly prescribed. Apart from that, certain drugs, they do you can say, they do impose the psychiatric symptoms. Okay, so for their management, we are also using what? We are using the psychotropic drugs. Okay, and that is we can call as the toxicity induces mental illness. Fine, no problem. So these are the indication. Now let's move ahead and discuss that what are the psychotropic drugs, what is their classification. Fine. Now let's discuss about the classification of psychotropic drugs. So basically the classification is based on the primary use. So depending upon the primary use of drugs, the psychotropic drugs are classified in the following types. The first type is called as the antipsychotic drugs. These drugs are also called as the neuroleptic drugs. This is also called as the neuroleptic drugs, also known as the major tranquilizers. Okay. These drugs are used primarily to manage, you can say, the schizophrenia symptoms. Apart from that, these drugs are also sometimes used to manage the manic patient, also used to manage the depressed patient. Fine. But the prime motive is these drugs are primarily used to manage the schizophrenic symptoms, you can say the symptoms of the psychosis. Fine. Now, then we have another drug called as the anti-manic drugs. What is happening in this manic patient? There is a pathological elevation of the mood. Okay, hyperactivity. These are the symptoms of the clinical features of the you can say the manic patient. Okay, and so for management of these symptoms, there is a administration of anti-manic drug. These drugs are also called as the mood stabilizer, because the mania is a affective disorder, mood disorder. So these drugs are called as the mood stabilizers. Okay, they stable the mood of a patient. Now, the another category of drug we have is the antidepressants drug, which is used in the very good. These drugs are used to manage the depression. Fine. Then we have the anti-anxiety drugs. Okay. Actually, you know, like if you pay your attention when we studied these drugs, then the antipsychotic drugs can use as an antidepressant, can use as an anti-manic drug, can use as an anti-anxiety drug, or it can use as a psychotomimetic drug. Okay, what it is? It is called as the psychotomimetic drug, also called as the psychedelics, okay, or hallucinogen. These are the alternative name of the psychotomimetics. So what I am saying, I am just saying that these drugs, depending upon the use, we are dividing into the different category. But the antipsychotic drugs can use as a mood stabilizer, can use as in the case of depression, or can use to manage the, you can say, the hallucination or anxiety. Got it? So what are the type? Once again, antipsychotic drug, also called as the neuroleptic drugs, also called as the major tranquilizers. Okay, then we have the anti-manic drugs, also known as a mood stabilizer. Then another category of psychotropic drug is a antidepressant. Okay, then next category is a anti-anxiety drug. Okay, then we have the psychotomimetic or psychedelic or hallucinogens. Okay, so these are the classification of psychotropic drugs. One by one, we will discuss each drug in detail. Fine. So let's start with the first category of drug, and that is called as the antipsychotic drug, also called as the neuroleptic drug, and also called as the major tranquilizers. Fine. Now